Well, hello. So, we are about 2 weeks into this nurse advocacy adventure. About 2 weeks ago, I dove in headfirst and have been doing this pretty much full time ever since. And let me tell you, it is a full time gig. Um, I wanted to update you on how things are going and let you know of some of the things I've been helping people with, and certainly share the information, and hopefully if it's helpful to you, you can share it with others. But last week I mentioned that there were some pretty terrible things going on based on the people that had reached out to me. A lot of folks that have experienced neglect in different types of healthcare facilities, nursing homes and hospitals and that sort of thing. Again, I'm not being hard on the frontline staff. I know things are really tough right now, but nonetheless, people are experiencing neglect and ending up with bed sores and, incapacitated, immobile. Like I said last week, there's just no excuse for that. But I wanted to give some advice for people that want to avoid that situation or keep closer tabs on their loved ones. And this is coming based on someone that reached out to me from the West, someone who is in an equally difficult position. Equally, I don't know what I'm comparing it to. Everyone that reaches out to me is in a difficult situation. But nonetheless, this person has been affected significantly by the fires out west. 3 members of the family had been significantly impacted by the fires out west, and going through all that, they needed to put their mom in a nursing home. That wasn't their wish, but it was just what needed to happen based on everything that was going on. So elderly mother ends up in a nursing home while these folks are trying to get their home life situated because of the fires. And then COVID hits and they can't see their mom. Mom's condition, dementia, is worsening. They're not able to get clear information. So last week, this person reached out to me and explained the situation. They are able to see her. They have to schedule their appointments. They're able to see her for like 30 minutes at a time, maybe once or twice a week, and it can't be a private visit. It has to be in a public area, and they have to wear their masks, and they have to stay, distanced and all that. And now, as I said, mom has dementia. She's confused. She doesn't understand what's going on. The daughter is the primary caregiver and is not comfortable with the situation. So she was coming to me for some advice as to how to get some more private time with her mom. So based on what I learned last week and just thinking it through, this woman is the primary caregiver of her mother. She has a duty to care for her mother completely. And in order for her mother to be able to feel comfortable in her situation, in her body, and in order for the daughter to feel comfortable in the care that she is required to provide for her mom, they need to have some private time. Emotionally, physically, for anyone, even those with dementia, those with different disabilities, private time with someone you care about is super important. If mom has a personal problem, she's not going to want to talk about it in the middle of the cafeteria, so private time is so important for those of you that are caring for loved ones that are in nursing homes. Not to mention the fact that you need to completely inspect, for lack of a better term, there needs to be an assessment done on a regular basis of your loved one's person. You need to look for skin breakdown, redness, bruises, cuts, scrapes, anything that is out of the ordinary or wasn't there the last time you looked. So you need to have some private time to do that. So that being said, I think if any of you are having issues with private time with your loved ones, you need to speak to the nursing home supervisor, director of nursing, whoever it is, and let them know that you are the primary care provider for your loved one. You have a duty of care. You need private time with this person, private time to discuss personal matters, private time to do an assessment of their physical and mental health, private time to support their needs emotionally. And based on the current rules, what I'm hearing about from many different facilities all over the country, that's not happening. And this is in no way, implicating that particular nursing home in any situation of neglect, but it's the fact that you need a baseline understanding should your loved one end up having to go to another facility, a hospital or something of the sort. You want to know that their skin is intact, that, there are no bruises, so that way if they do go somewhere else and they end up with something, you know that it didn't happen at the facility that they're currently residing in. Nursing homes are not prisons. And the fact that these people are not allowed to, move about or leave the facility, or they're only allowed supervised visits, it's mind-blowing right now. But a lot of people just don't know what to ask, or they're told no and they accept no as an answer. Don't do it. Keep pushing, keep pushing, keep pushing, because your loved one depends on you and you have a duty to care for that person. And if you find signs of neglect, skin breakdown, bruises, extreme weight loss, anything like that, that needs to be dealt with right then and there. It needs to be documented. And if for some reason, there's pushback, don't hesitate to call the police if you feel that there is something suspicious going on. And I don't want to imply those things, but based on the information that I'm hearing, it is absolutely happening. So if you have a loved one in a nursing home and you're not able to see them in the capacity that you wish, as far as private time together, the ability to do a physical assessment, reach out to me and I will do my best to help you make it happen. It's been quite a week. The next thing I definitely want to talk about is birthing mothers. Mamas, you got it tough right now. It is so hard to be having babies in the hospital. That's definitely up there. My top 2 requests right now are nursing homes and mamas giving birth. So I'll talk about that again soon. I hope everyone's well. I'll talk to you soon. Bye.